morning, and the sun sparkled like silver across the breaking sea. Flying along
Day after day, for 4 hours at a time, this little girl is hooked up to an intravenous drip. Charlotte is only 7, but in her short life, she's had more than 40 fractures. Charlotte has brittle bone disease. Here at Sheffield Children's Hospital, in the north of England, Charlotte was one of the first patients in the world to benefit from a revolutionary new treatment. A drug developed from an ingredient in washing powder has changed her life.
It goes all the way down through that bit of white bit, through here, and through that yellow bit, and then it goes into my hand, where it goes all around my body to make me strong.
It means a 3-day stay in hospital every few months, but the drug trickling into Charlotte's veins is the best chance there has ever been for children with this potentially crippling genetic disease.
This treatment has been the largest step forward we've had in the treatment of these children for many, many years.
Charlotte was born with a broken arm, a broken shoulder and 2 broken legs.
More or less straight away we knew there was something wrong. We didn't know what it was. We were told the next day that she had this condition, osteogenesis imperfecta, and that was quite a shock because we'd never heard of it before.
Osteogenesis imperfecta literally means imperfect bone formation. Like the adult equivalent, osteoporosis, the bones are riddled with tiny holes, making them weak. It's an inherited condition and there is no cure.
But I don't like talking about me when I break my legs.
Why not?
Because it's just, I don't like the words like snap and stuff like that. I hate that word.
The slightest fall getting around the house, even just standing up, could break a bone and mean a trip to the hospital.
Just fed her and I was winding her and her arm snapped as I was sort of rubbing her back. You really are living on a knife edge because you never know when it's going to happen.
But things are looking up for Charlotte, thanks to a type of chemical originally developed to stop washing machines clogging up. The chemicals were found to stop mineral build-up in pipes, but when doctors tried the new compounds to remove mineral build-up in people, in the form of kidney stones, they had quite the opposite effect.
It didn't really have any effect on kidney stones at all, but the investigators noted that bone mass increased substantially in response to these drugs. It's serendipitous in a way that we've got a treatment that seems to be so effective in this particular population. I'm very pleased for them because they really need it.
Charlotte has regular bone scans which show what effect the drug is having. This X-ray machine can calculate the mass of Charlotte's bones. In the small number of children treated so far, the results have been dramatic.
On average, a child will increase their bone mass with this treatment by about 40% in a single year. With normal growth, and as a child gets bigger as they grow older, you would expect to see an increase of between 10 and 15%. So we're going at about 4 times the normal rate.
And the news for Charlotte, too, is good.
That middle line on that green bit is where everybody should be if their sort of bones are perfectly healthy, and that's where you are. Yeah, I think that's right.
So soon my bones will get even stronger. Like.
As time goes by, they'll get stronger and stronger. Compared with when you started on the treatment, you've done really well, and your bones are really getting there.
News of the treatment has spread. Catherine Watkins has come from her home in South Wales. She's lived with severe brittle bone disease for 14 years. It's had a devastating effect on her growth and made it very difficult for her to lead a normal life.
If I'm not careful on what I'm doing, I just break. And I broke once by just drying my hair. So I just don't want to do that anymore.
In terms of its short-term effects and on quality of life, I don't think there's been anything like this for this group of children before.
Back home in Bournemouth, Charlotte attends normal school. She can walk short distances and play with younger sister Molly. It's a far cry from the short wheelchair-bound life doctors predicted for her.
When she was born, the prognosis was so grim. The fact that there was nothing on the market for her either, nothing available, and within 5 years there came a treatment that has helped her significantly. So who knows in another 5 years what they might come up with. Yeah, I'm very confident for the future.
That must be a whale.
Maybe it's the mermaid.
Charlotte is fairly optimistic too.
I'd like to manage to do cartwheels because I saw Nadia do them in the playground, and handstands, like do a handstand and then walk upside down. That's what I really want to do. And I don't want to use my walker anymore or my wheelchair.